Hello. This module is on challenges in disaster research. Disaster research is essential for improving preparedness, response, and recovery following natural hazards, technological disasters, and public health emergencies. Evidence generated from disaster studies helps identify effective response strategies, improve emergency planning, and strengthen health systems. However, disasters create environments that differ dramatically from controlled conditions typically required for research. Infrastructure may be damaged, populations displaced, and communities may be experiencing trauma or loss. These conditions introduce both operational and ethical challenges that affect how disaster research can be conducted. Throughout this lecture, we'll examine the logistical and ethical constraints researchers face in the disaster environment and discuss challenges of conducting rigorous and ethical research under these conditions. The lecture focuses on three primary learning objectives. First, you will learn to identify the operational and ethical challenges that commonly arise in disaster research. These include logistical barriers such as infrastructure disruption and ethical concerns associated with working with vulnerable populations. Second, you will analyze how these constraints shape research design, implementation, and interpretation. Disaster environments often require adaptation to traditional research methods. And third, you'll examine strategies that researchers can use to mitigate feasibility and ethical barriers while maintaining scientific integrity. Disaster research contributes directly to evidence-based preparedness, response, and recovery planning. Studies of past disasters help identify specific failures and guide policy reforms. For example, research conducted after Hurricane Katrina revealed major weaknesses in hospital evacuation planning, emergency communication systems, and coordination between local and federal agencies. These findings led to important reforms in hospital emergency preparedness requirements. Similarly, research following the Fukushima nuclear disaster examined radiation exposure, mental health effects, and community displacement. And those studies informed international nuclear preparedness policies and highlighted the long-term psychosocial impacts of disasters. These two examples illustrate how disaster research transforms experience into knowledge that improves future response. Disasters do create unstable research environments that are characterized by damaged infrastructure, disrupted communication networks, and rapidly changing conditions. Roads may be impassable, hospitals overwhelmed, and communication systems unreliable. At the same time, populations may be displaced to shelters or temporary housing, complicating the recruitment and the follow-up in research studies. Disaster response systems also involve complex coordination among government agencies, emergency responders, community organizations, and healthcare systems. Drybeck explains that disaster response often involves multiple overlapping organizational networks operating under conditions of uncertainty. These coordination challenges affect researchers' ability to assess disaster sites, collect data, and collaborate with response agencies. Disaster environments are shaped by this complex coordination process. Um, and the challenges influence both the response operations and your ability to carry out your research activities. I highly recommend reading the Drawback 2017 article. The reference is at the end of the presentation because this will help you to understand what some of the challenges are that you may face. Because disasters create unpredictable environments, researchers rely on a variety of study designs. Rapid assessments are commonly used to gather immediate information about community needs during this phase. Cross-sectional surveys may evaluate health impacts of preparedness behaviors, and cohort studies are used to investigate long-term health effects, such as respiratory issues following wildfire smoke exposure. Qualitative studies are also essential. Interviews and focus groups can provide insights into community experiences, their ongoing coping strategies, and barriers to recovery. And of course, the gold standard, the randomized controlled trials, they really aren't feasible during a disaster. You can look at the 2017 article by Peak and Tobin, and it will talk to you about some of these concerns and some beneficial interventions and ethical concerns. Operational barriers are among the most significant obstacles to disaster research. Infrastructure disruption may limit your access to affected areas and your ability to communicate, and the ability not only with people but with your research team. Emergency responders don't always want you there. They find you to be in the way, so they may restrict access to the disaster zones for safety reasons. You really do have to coordinate closely with emergency management organizations to conduct field work. And if you're going to do this, you need to know them in advance. You're not going to walk onto a scene where no one knows you and think you're going to get access. Snyder in 2017 noted that disaster response often involves multiple levels of government authority, which can also complicate coordination and decision making. So you're going to have some data challenges: missing baseline data, inconsistent reporting, and limited surveillance. Reliable data collection is another major challenge in disaster research. Baseline data about affected populations are often unavailable or incomplete. Different agencies may use different reporting systems and definitions, making it difficult to combine data sets across institutions. The COVID-19 pandemic demonstrated how inconsistent data systems can complicate research. Different jurisdictions reported cases and deaths using different definitions, which made early comparisons across regions very difficult. And researchers often rely on multiple data sources, such as hospital records, surveillance systems, surveys, and interviews to conduct a comprehensive understanding of disaster impacts. One example I can give is that there are only 6 minority-majority states in the United States. And in one of those states, we wanted the COVID-19 data reported with the rest of the data, so it would be in this big data set that we could use through the National Institutes of Health. By the time we finally got it reported and got all of the information from that state in, 3 years had passed. COVID-19 was over as a pandemic, and anything we were going to do at that point would be outdated. You also have to worry about time constraints. Are you ready to rapidly deploy? What are you going to be your urgent data needs? And what policy decisions have to be made quickly? Disaster research frequently occurs under intense time pressure. Public health officials and emergency management often require rapid information to guide their response decisions. Researchers, you're going to need to balance the need for timely data and the need for scientific rigor. Rapid assessments may sacrifice methodological precision in order to produce what you need really quickly. And this is going to cause tension. There's going to be tension between speed and accuracy, and that is going to be one of the defining challenges of disaster research. You also need to know that the population that you're wanting to study is going to be in a state of disruption. Some of them will be displaced, some will have trauma, and then there's also healthcare disruption. Disasters frequently displace large populations. Individuals may relocate to shelters, temporary housing in different regions entirely, and these transitions complicate recruitment and your longitudinal follow-up in your research studies. So who you have today, you may not be able to find in 3 months. Post-disaster housing systems often involve multiple stages, including the emergency shelters, temporary housing, and permanent housing. Peacock, Dash, and Zhang in 2017 emphasized that the transition can last for years and significantly affect health outcomes and social stability. These housing dynamics create additional challenges for you as a disaster researcher when you're attempting to follow the participants over time. Displacement and housing instability really are common consequences of disaster, and they can last a long time after the initial event. They may last months to years. Researchers research following the major disasters, it has shown that sheltering and temporary housing arrangements can significantly influence the health outcomes, the social networks, and the recovery process. Peacock and colleagues highlighted that post-disaster housing systems involve multiple stages, including multiple types of shelters. So you will have your temporary shelter, then temporary housing, and then long-term reconstruction. So just know that it's a transitional process for the people, and people that may originally want to participate in your study may become very frustrated or overwhelmed over time and drop out or just be lost to follow-up. You're also going to have ethical challenges. First of all, you're dealing with a vulnerable population. You're going to have difficulty with informed consent, and you always have to worry about the risk of coercion. The ethical considerations are central to disaster research because disaster-affected populations are often highly vulnerable. Survivors may be experiencing trauma, displacement, and a hard time getting the resources they need: food, shelter, clothing, medical supplies. Researchers need to ensure that participation is voluntary and that individuals do not feel pressured to participate because they are receiving aid or services. Protecting participant autonomy and minimizing harm are core ethical principles that must remain central in disaster research. You're going to have to think about your informed consent issues of language barriers, stress and trauma, and limited literacy. Obtaining informed consent during disasters can be challenging. Individuals experiencing stress or trauma may have difficulty processing information about research procedures. Language barriers, literacy limitations, and cultural differences may complicate communication. Researchers, that's you must adapt consent procedures to ensure participants understand the purpose and the risk of the study. Some other ethics review challenges you're going to have. Your IRB delays can be a huge problem, limited disaster expertise, and then jurisdictional issues. So institutional review processes may not function efficiently during disasters. The standard review timelines may delay the urgently needed research. You need to make sure you have a preliminary approval for research through your IRB in advance and a procedure set up with them to do a rapid update and approval within days. Most IRBs aren't set up to do this, so this is something you must work on in advance. Some institutions have developed rapid ethics review procedures specifically designed for disaster research protocols. NIH has one, and you need to look at what those are and how to get it implemented in your institution. You also have to consider your safety as a researcher. You need to be aware of the environmental hazards, violence risk, and psychological stress. Researchers, you must consider your own safety when you're working in disaster environments. Hazards can include things like unstable buildings, contaminated water, hazardous materials, and exposure to infectious diseases. The institutions must develop safety protocols and training programs to protect you as a researcher conducting field work in the disaster zone. That means your institution must do this in advance. This isn't something you can see a disaster, say, oh, I need to put protocols in place, let us do that. It won't happen fast enough. So this has to be work done in advance. You must consider the cultural context in which you're working in. You have to develop community trust. This is hard in a disaster. You have to know the local norms, and you have to know what your community priorities are. So cultural awareness is essential in disaster research. Communities may have different beliefs about risk, health, and disaster response. And engaging local leaders and community organizations can improve trust. You need that trusted person in the community that can help ensure that your research aligns with community priorities. Again, while this can be done during the immediate aftermath of a disaster, it really helps if you have community connections in advance. Let's talk a little bit about knowledge translation. There are fragmented knowledge systems and there's some weak policy connections. So even when high quality disaster research is conducted, translating those findings into policy and practice can be difficult. Communication barriers between the scientists, the researchers, and the policy makers really can limit the influence of research findings on disaster preparedness planning. And one of the other problems we have is, as academics, we tend to want to do research, and then of course we have this whole publish or flourish thing, which in many ways is not helpful to the public. It helps us as professionals, it helps us advance our careers, and it does nothing for the general public, because we publish in journals that are frequently behind firewalls that and are written in a way that other academics will read and understand, but the average person out in the field will never see it. If they do see it, it's going to be dry and something that is written in a way that's not understandable or meaningful to them. And the general population, the person on the street that needs to know how to prepare, they're not going to see it either. And I realize there's levels of knowledge of what people need, but when we produce knowledge in a way that isn't useful to the average policymaker, the average politician, the average community planner, the average person running a shelter, what we have to ask ourselves, what have we done? And then there are going to be constraints on your study design. Convenience sampling, rapid surveys, and observational studies may not be what you want to do, but it may be what you can do in a disaster. The operational constraints often shape your disaster study design. You frequently rely on convenience sampling or rapid surveys because representative sampling may not be feasible. Observational studies really are common in disasters because experimental design may also raise ethical concerns. You always need to address bias in your research. So is there selection bias? Is there recall bias? And is there loss to follow-up? Disaster studies are vulnerable to several types of bias. Selection bias being one because you're selecting the people that are available to you. If you're going to a shelter and that's where you're doing selection, then you're only sampling the people who had to use a shelter rather than people who were staying with relatives or were able to get a hotel or had a second home somewhere. Not that that's that common. You may have recall bias. We know our memories are flawed and what we remember is not always accurate. And then you will definitely lose people to follow up if you do a study over time. So as researchers, we must acknowledge that our research is going to have these limitations when we're interpreting the results. Interpreting disaster research findings requires careful consideration of the broader institutional and social context in which the disaster occurred. Disaster outcomes are shaped not only by the hazard itself, but also by governance structures, coordination mechanisms, and recovery policies. Snyder in 2017 emphasized that government's response systems strongly influence how resources are distributed and how recovery programs are implemented. As researchers, we must interpret the disaster data within the context of these institutional factors. We cannot ignore them. They will be different in every disaster, in every community. So, one of our goals is to mitigate some of the ethical barriers. So, strategies for addressing ethical challenges, including rapid ethics review systems, community advisory boards, and transparent communication with participants can help. So remember, you need to have an ethics review board, an IRB at your institution that would do a rapid ethics review. You ideally already need in place community advisory groups if you're working in your own state. If you have places that are disaster prone, it helps to have a community advisory board that is broadly representative. And then you need transparent communications. You must talk to the community. You must be open about what you're doing and why you're doing it. You have to tell people about the benefits to them. And if there's no direct benefits to them, you need to state that up front. So community engagement improves trust and it ensures that the research addresses the local priorities. Collaborative approaches will help to ensure that the research you're doing benefits the affected population rather than exploiting them. This means you need partnerships with local leaders and you need community input on your study design. Again, this requires community engagement in advance of a disaster. So, you're going to need some training and you're going to need some competencies. You need ethics training, really that's specific to disasters. You need risk communication training, and you need interdisciplinary collaboration. Everybody thinks that's easy and straightforward, but it helps if you've been to some very specific training on how to do that. Disaster researchers require specialized training in ethics, risk communication, and cultural competency, and interdisciplinary collaboration. Education frameworks emphasize the importance of preparing healthcare and public health professionals to conduct disaster research responsibly, and you need to make sure that you have gone the extra mile and make sure that you have prepared yourself as a researcher. So, some future directions in disaster research include rapid ethics review systems, longitudinal studies examining long-term disaster impacts, and community-led research initiatives. So, here is something for you to think about and to consider. Consider the ethical dilemmas that researchers face when collecting data from disaster survivors. How should the researcher balance the urgency of gathering information with responsibility to protect vulnerable populations? Now, you don't have to submit this to me or anybody, though you could post it in comments on YouTube, or you can send me an email about what you think the answer is. But I would ask you to stop your video and give yourself a 15-minute break and time to think about this and write an answer down and then come back. Okay, I'm going to assume you did take a 15-minute break and that you did take time to think about the discussion question. Disaster research is essential, but it really is complex. There are going to be operational barriers, ethical concerns, and institutional structures that shape how you can do your study, how you design it, and how you can implement it. The ethical frameworks, the community engagement, and the interdisciplinary collaboration are really critical to conducting responsible disaster research. So to restate this, you have three key takeaways. Operational barriers shape your research design. Ethics are central to disaster research, and community engagement will improve your research quality. Here's a list of references for you. I would suggest if you're really interested in disaster research, you take a look at these and do more study about disaster research. Thank you for joining, and I will see you on Canvas.